So next we're going to look at the need for baby's safety, and we're going to look at the advice for how to sleep your baby safely when baby's not on mum. We get this advice from the Lullaby Trust, who have been researching the evidence and the statistics for many years now, and by changing it to their advice, we have actually reduced the number of sudden infant deaths. And sudden infant deaths is awful when it happens, but you do have to remember it's not something that happens all the time. And sometimes it does just happen, but there are lots of things you can do to reduce the risk in your own circumstances for your baby, and that's what we're going to look at. So we would go to you can go and have a look yourselves at home, but we've also got the link for looking at the Lullaby Trust advice on safe sleeping. Okay, hopefully you've now seen the Lullaby Trust advice, and I'm now showing you a baby that I've settled down to sleep in the cot earlier. So I've got baby in a Moses basket because they tend to be smaller and therefore easier to fit in your bedroom. Baby should sleep in the same room as you for the first 6 months, and then would then move into a larger cot later on. We're following the rules of the flat, firm, well-fitting mattress and covered in. Most bed sheets would have elastic on and hold them in a little bit tighter. I've got baby here using a blanket. I know they talk a lot about the sleep bags, particularly the grow bags. With that brand of grow bag, they have worked with the Lullaby Trust, and they do have extra fasteners under the armpits and around the neck to get a better fit. But you are allowed to use other brands, but what's most important is that they do fit properly and must be the right size. The danger is if the bag is too big, the baby, especially if it's trying to curl back fetal, it will pull its arms in and head in, and it can end up back in the bag. And I did see a newborn baby in a bag too big a little while ago. So it needs to fit. So sometimes in the immediate days after birth, they're not necessarily the right thing if they're too big. Another reason why using a blanket, which is perfectly acceptable to use as long as it's tucked in tight, is because with a blanket you can get the tucked in tight feeling that the baby wants, as if it's back inside mum, and that tends to help them settle. With the bags, if you're using those, they come with different TOG ratings, so you would use different thicknesses at different times of year, and you then also have to adjust the layer of clothing underneath. And another advantage of a blanket is it's easier to adjust the levels of blankets without disturbing the baby, and you can add one or take one away if necessary. If you've got any information about how many blankets to use, and we talk about 2 blankets or 1 blanket, we're talking about layers of blanket. So if your blanket is folded over on the baby, that counts as 2 blankets, and you'd have that thickness. This sort of blanket with a bit of mesh is good. Something with a little bit of stretch is good, because it can help to tuck it in firmly. We never put it actually over the shoulders, and we've got baby's feet right at the bottom of the bed. That's very important when they're under blankets, not so much when it's in the bag, but it's to stop it baby moving further down and underneath the blanket. We've got the cot free of any cuddly toys. A lot of you may be getting something like You and the Sheep, who makes the sounds for the baby with the white noise, or they may have a phone with the app on. I believe there's another animal out there now as well. I can't remember what it is, but by all means use them. They're brilliant because they again make baby feel like they're back in the womb with the sound. Do put on a sound that you can sleep to. Do try to get one that plays a bit longer than 10 or 15 minutes, but don't put them in the cot. Have them safe away from actually from baby. Something else, so one of the main worries is about the baby not getting too warm. So something that you can get from the Lullaby Trust is one of these thermometers. They sell them for £3. You can get similar ones from other shops, Boots. I was going to say Mothercare, but I believe they've closed down by now. And it's got the advice written on the back, and it's got the guide of the right temperature. And they're saying between 16 to 20 degrees. Now that's quite a range actually when you feel it. And certainly 16 can feel a bit too cool to you as a mum, or certainly to me. And so it's a good idea to have a room thermometer. I can tell you now, as parents looking after a newborn baby, with the worries, the stress and the tiredness, and just the difference between men and women, you'll disagree over the room temperature unless you've got a thermometer telling you what it is. While I'm talking about safe sleeping, I have got here as well to remind me about not having other things in the cot, like this plastic bag and the nappy. And you might think you would never have them in there, but often people do tuck bits in. You're going to be having baby in the Moses basket upstairs and going to carry baby downstairs for the day. You tend to pop bits and pieces in. But the other time when, and you shouldn't, or you need to take them out. But the other time when nappy sacks can end up near baby is when baby's laying on the changing mat ready for you to change and you've gone off to get something else. And there have been several instances, I believe it's 5 in 2 years, of deaths from pretty young babies where they have picked up the nappy sack, because all babies are born, all well babies, term babies, are born with a grasp reflex, and they'll grab anything that their hands touch. And that's why you see all these lovely pictures on Facebook where they're holding onto mummy's finger or whatever. And I believe the grasp reflex stems from back in monkey days when they would have hung on to mum, and they can hang on tight. So if that's laying on a changing mat near baby and baby's crying and wriggling because it's hungry and actually wants feeding, and you've gone off to get the water to change baby's nappy, you can pick that up accidentally, and the next thing a hungry baby will do is put it to its mouth. Babies can't ungrasp, they can only grasp on. Bond it, so that they can end up suffocating themselves. So nappy sacks are actually a hazard for babies. I would also say environmentally they're not good, and probably, to be honest, aren't very necessary. With that odd time when you're out and about. The rest of the time, you could just get yourself a plastic bin outside the back door and drop any nappies after you use them straight outside in the bin, ready for going out to the dustbin. So we've been talking about settling baby into the Moses basket and making that safe, but some people will choose to co-sleep with the baby or share the bed with the baby. There are some circumstances in which that is particularly dangerous, and that would be if your baby was born premature or very low birth weight. Also, if either anyone who's in the bed as well has been smoking, even if they're not smoking in the bedroom, or have drunk alcohol. You shouldn't have pets sleeping in the bedroom if you're going to be, well, they shouldn't really be in the bedroom even if the baby's in the Moses basket, but they shouldn't be on the bed, or other children in the bed as well. But what the rule of it is that they should be on a flat, firm, washable surface, really. Or certainly the Moses basket mattress should be washable. Your own one may not be. But that rule applies whether it's in your bed or the baby's bed. So it's no good having a dippy mattress where you roll into the middle at all, and it mustn't be a waterbed. And you need to clear that area where the baby's going to be sleeping of any pillows that it could end up under, or a thick duvet. Some people would put his own blanket over the baby, but then that becomes loose bedding. So it may be that baby's warm enough with the clothing that it's got on to not need a blanket of its own at all, because it is in the bed near the mother. Or that's where you would use one of the sleeping bags, because that moves with the baby and it's no loose bedding. Unfortunately, some of the tragic incidences of sudden infant death happen when mums normally or dad settles a baby in the basket, but then for one night or for some reason chooses to bring the baby into bed when they don't normally do it. So if you're going to bed share, you need to set the bed up so it's always safe in case you bring baby into bed with you. On a realistic note of real life at home with a baby, quite often what ends up happening, because the baby shouldn't be asleep between the parents, it should be on the outside of the mother, so because of the other person in the bed is the one that's more likely to roll on the baby. In reality, quite often what happens is the partner ends up moving into that lovely nursery that you got all ready, that you nagged him for ages to get ready, and now it becomes the partner's bedroom. Because at the end of the day, realistically though, they have got to get sleep, they have got to go to work, they've got to be safe. So they move out and give you a whole double bed, lots of room for you and your baby, and that works fine in lots of households. And so many of you may end up making that decision. What is very dangerous is to decide that you're scared of falling asleep with your baby in your bed and getting out and going downstairs onto the sofa or in the chair, because that's a dangerous place to fall asleep with your baby, more dangerous than settling down in a safe bed with your baby. And so other things to bear in mind regarding sudden infant deaths is it doesn't always happen when you're settling them down to sleep at night. So it can also happen in car seats or in prams or in baby carriers or slings. So there is guidance from the Royal Society of Prevention of Accidents about the way to choose a safe baby carrier, and we can show you that information. And it's by the rule of ticks, is what they say, but that guides you through what makes a carrier safe. What you don't want is a sling where the baby ends up curled up with the closing airways off in a sling shape. It needs to be something that holds baby up nice and firm and within sight and near the breast. So to rule out that as a danger area. And then with thinking about car seats are not designed for babies to sleep in. They're designed for safe transport in a vehicle. And so they should not be left sleeping in the car seat. 2 minutes as you unload the shopping is fine, but not for any sort of length of time. After that, baby should be removed and laid on a flat firm mattress to finish off its sleeping. Think about how warm you're keeping the baby in the car. This is a tip now. Rather than putting your baby in the car with lots of extra layers on, you should remove any slippery coats and bulky coats anyway on the child as it gets older as well. But it's better to put the baby strapped in nice and firm and tight, so just 2 fingers slides in, and then put the extra blanket over the baby and maybe a hat on baby when you've first gone out to the car because it's cold outside and the car is cold. As it warms up, you need to remove those, but you can remove those while the baby's still strapped in. And talking about that, when you're taking baby out in a pram, so if it's winter and you're taking the baby out in the cold, you will have wrapped baby up warmer, you'll have a cover on the pram and a hood up. You take baby out, you get baby to sleep. It's one way of getting your baby to sleep in the day, is to take it for a walk because it likes the movement and it's all snug and secure. Think about it going back inside. And then you come back indoors, baby's sound asleep and you want to get a cup of tea. You've succeeded in getting baby to sleep. You've got to now take off lots of those layers off baby because otherwise baby will get overheated back inside. So that's where you would then take off all the outside covers and the hat and any extra. It's easier to take off extra blankets than it is to take off a chunky jacket. So just bear that in mind, that when you come back in, you're going to be stripping bits off, and if you don't want to wake baby up, it's safe to leave baby sleeping in a flat pram when you get back inside, as long as it's not too warm. And while we're talking prams, in the summer, it's the other way around. You're going to end up with the baby out in the sunshine, lightly dressed and everything, but a lot of people worry about the sun, and the baby should be protected from the sun. But what we mustn't do is cover the pram up with a blanket or even a muslin cloth is too much. It traps air inside, it heats up the pram very quickly, and you've got the overheating of the baby again. Much better to protect the baby from the sun by a proper sunshade, which can be the flexible ones, which are good because you can put it either side depending where the sun is, or one of the square ones that fits down so that air can move underneath. And you're protecting the baby from the sun, and they can give UV protection as well then, those. So there's just a couple of extra things to be aware of. It's not just always in the bedroom. And one of the other sad facts about when it happens is quite often when it's something that happens, it'll be when you're not doing your normal routine. So you can be very good, very safe, in practice, do it all the time, and then you go away on holiday, or you go and stay at the grandparents' house, or something like that changes, and then that's when things aren't done the way they normally are, and something can happen. So it is one of those things you've got to be aware of really all the time. Okay, so as part of keeping your baby safe, obviously, is to be able to recognise if your baby is poorly at all. With young babies, things can change quite rapidly, so it's a good idea to be aware of signs of an ill baby. I will say, if you are worried or concerned at all, please do ask for support and advice, and you can always bring your baby to a midwife if it's just a smaller thing. But if you actually think baby's really quite ill, then you would be ringing 111 or the GP surgery. If you actually feel your baby's not breathing right or something, then it may be 999 that's appropriate. But please do ask, don't sit at home and worry about things. So the signs of an unwell baby is mainly going to be changes from what you've already learned as being normal for your baby. So the colouring, it may be yellow already from a bit of jaundice, which we'll talk about more in a minute, or it may be more of a blue mottly colour that's not right, because we really want a pink baby. And its temperature will change the same as it does for a lot of people when they're ill, but with a young baby, when they're ill, quite often they go cold rather than hot. So You just want a normal range of temperature. So we're talking about from 36 to 37.5 centigrade would be normal range. Anything below 36 is too cold, and above that would probably be too hot. Sometimes it's just that they've been overwrapped and you would adjust that. But there's other signs of illness that would go along with that change in temperature. So a baby that normally is a bit alert and active between feeds and suddenly isn't waking for feeds, very unusual for a baby to not want to feed at all, so that needs to be looked at. A baby that keeps vomiting, either all its feed back all the time, or if it does more of a discoloured vomit, so it might be green stained, or which we call bile stained, or with a bloody vomit, might be something that needs to be looked at as well. And a baby that you'll be experts on your baby's cries very quickly, and all the different cries for the different things. But even early on, you get the odd baby that has more of a high-pitched cry right from birth, but most of them don't. And if your baby develops a high-pitched cry, that is very much a warning sign. So you would need to think about that. With babies breathing, they do breathe in different patterns, and sometimes they breathe so quietly, so shallowly, you don't even know if they're breathing. You tend to shake and say, oh, it's awake, that's okay. It's all okay when you wake it up. But other times it breathes quite rapidly and it's clear to see, but it's as a transient thing, it's only for a short while, and you might particularly have that on a baby that was born by caesarean section. But a baby that's constantly breathing quickly, and maybe its nose is flaring open as well because it's trying to get the air in, or it's drawing in at its ribs each time when it breathes, you see the tummy just suck in and the ribs all show. That's a baby that's struggling with its breathing. So if it's rapid breathing for more than a half a minute or so, and doing any of those things, that's not right at all, and the baby's having problems with its breathing. Another thing you might notice on baby is rashes and spots. This is a difficult one. I would always say get spots checked out if you're not sure, but they often have little white spots on their face and on their body, even with little white heads in, and we don't tend to worry about those. But anything with the green head in we would worry about, and there's more of a finer rash all over the body is more of a worry. One way to test if it's the rash that would go along with meningitis, and would also go along with septicemia or sepsis as we call it, is a rash where if you were to get a clear drinking glass and roll it over the rash doesn't disappear. So when it's any of the other spots, it's skin related, and so by pressing on the skin they go away. But when it's to do with these illnesses that we're talking about, it's actually to do with the blood picture underneath the skin, and so it doesn't go away by pressing on the skin. So when you roll over a clear glass over, drinking glass over it, and the rash stays there, that is a severe warning sign, and then you would need to get baby seen straight away. And like I say, it can be 111 is normally your first call of action. If for some reason they're just not responding, you're left waiting a long time, and you're really concerned about your baby, then you would be within your rights to ring 999. But if it's just for not sure about a rash, or you're not sure about this or that, then please do ring the maternity services. For the first 4 weeks, you still come under their care. Okay, so I mentioned briefly earlier about a baby if it's jaundice. So when we're talking about jaundice, we're talking about the baby developing a yellow colour. Some people sometimes call it a suntan and think that it makes their baby look healthy. But to us as midwives, that's jaundice. And it's all about the level of it, and whether it's a normal type of jaundice or whether it's reflecting a problem. Because jaundice, especially if it comes on in the first 24 hours, can be connected to infection. So if your baby's turning yellow before it's 24 hours old, you certainly need to let someone know as soon as you notice it. We would normally end up seeing a baby quite soon, within the first day or so of birth anyway, and so it might be us that picks it up, or at day 2 or 3 we would see it developing. One way that we would check to see it, depending on the baby's natural skin tone, would be to press its nose. And when you press the nose, what would be white is actually yellow. Then you can see that there's some jaundice there. And we would need to see that baby really just to check levels. It's quite hard to tell just by going by skin tone just how much jaundice there is. Even if it's a natural jaundice, we don't want it over a certain level. We can locally check the baby, not with needles at that point. I don't need to take blood, but we just use our device here, which sends a light through the chest wall. We do it 3 times to get a nice average reading, and depending on that result is whether baby needs to go for further blood tests down to Truro. Like I say, it can happen very naturally. It's just part of the process of another part of that developmental change of living it outside with its different type of red cells to what it had when it was inside. The way to get rid of the jaundice is by baby feeding plenty. When it's normal jaundice and not at a dangerous level, the more baby feeds, the more it wheezes and poos. The more it wheezes and poos, the more it gets rid of the jaundice. What we don't want is the jaundice level to build up too much, and then it makes baby sleepy, because then baby doesn't feed, and the jaundice gets even stronger, and even if it's a natural jaundice, it will then make baby poorly. So we just need to know about levels. You will get information about it after baby's born, but just bear it in mind, and once we've checked it over, then we know that everything's okay.